Ovarian cysts are fluid-filled sacs that develop on or within the ovary. They are common in women of reproductive age and are usually benign. However, in some cases, they may cause symptoms or complications. Here's a detailed overview of the signs and symptoms associated with ovarian cysts. 1. Overview of ovarian cysts. Ovarian cysts can be classified into different types. Functional cysts. These are the most common and typically occur as part of the menstrual cycle. They include follicular cysts and corpus luteum cysts. Pathological cysts. These are less common and may arise from abnormal cell growth, including endometriomas, dermoid cysts, and cystadenomas. Most ovarian cysts are asymptomatic and resolve on their own without medical intervention. However, when symptoms do occur, they can vary based on the size, type, and location of the cyst, as well as whether it has ruptured or twisted. 2. Common signs and symptoms of ovarian cysts. The symptoms of ovarian cysts can range from mild to severe. Here are some common symptoms. A. Abdominal or pelvic pain. Mild to severe pain. This can vary depending on the size of the cyst. Larger cysts may exert more pressure on surrounding structures, leading to discomfort. Dull ache or sharp pain. Pain can be continuous or intermittent. Sharp pain often occurs when the cyst ruptures or twists, a condition known as ovarian torsion. Pain on one side. Often, the pain is localized to the side where the cyst is located, though it may radiate to other areas. Pain during menstrual cycle. Some women experience more severe menstrual cramps due to the presence of ovarian cysts. B. Bloating or abdominal fullness. Swelling in the abdomen. Large cysts can cause visible swelling in the lower abdomen. Sensation of fullness. A feeling of fullness or pressure may persist even without eating. Difficulty eating. Some women may feel full quickly after starting a meal. Pain during intercourse. Dyspareunia. Discomfort during or after sex. Pain during intercourse is a common symptom, especially when the cyst is large or located near sensitive structures. Deep pain. The pain tends to be deep, often on the side where the cyst is located. D. Menstrual irregularities. Irregular menstrual cycles. Functional cysts may interfere with hormone levels, leading to delayed, missed, or heavier than normal periods. Spotting. Some women experience spotting or unusual bleeding between periods. E. Urinary symptoms. Frequent urination. A large ovarian cyst may press on the bladder, causing frequent urination. Difficulty emptying the bladder. Pressure on the bladder can also make it challenging to empty it completely. F. Gastrointestinal symptoms. Bowel discomfort. Some women experience constipation, bloating, or general abdominal discomfort due to pressure on the intestines. Nausea and vomiting. This can occur if a cyst ruptures or if there is an ovarian torsion, which is a medical emergency. G. Changes in weight. Sudden weight gain. Large cysts can cause apparent weight gain due to the fluid and tissue in the cyst. Unexplained weight loss. This may occur if gastrointestinal symptoms prevent proper nutrition. H. Lower back pain. Pain in the lower back. Larger cysts can place pressure on the muscles and nerves in the lower back. I. Breast tenderness. Hormonal changes. Some cysts can alter hormone levels, leading to symptoms like breast tenderness, similar to premenstrual symptoms. 3. Complications of ovarian cysts. In some cases, ovarian cysts can lead to complications, which may present with specific signs and symptoms. A. Ovarian torsion. Ovarian torsion occurs when a cyst causes the ovary to twist around the ligaments that support it. This condition cuts off the blood supply to the ovary and is considered a medical emergency. Sudden, severe abdominal pain, often on one side, accompanied by nausea and vomiting. Fever may occur in some cases. Pain during movement. The pain is often worsened by movement. B. Ruptured ovarian cyst. If a cyst ruptures, it can lead to sudden, intense pain and, in some cases, internal bleeding. Sharp, sudden pain, particularly in the lower abdomen. Abdominal tenderness, pain and sensitivity in the abdomen. Lightheadedness or dizziness, due to blood loss if internal bleeding occurs. Nausea and vomiting, common with sudden, intense pain. 4. Risk factors for developing ovarian cysts. While many women develop ovarian cysts at some point, certain factors may increase the likelihood of developing symptomatic or complicated cysts. Hormonal imbalances. Issues with hormonal levels can lead to the formation of functional cysts. Pregnancy. Sometimes a cyst that forms during ovulation remains on the ovary throughout pregnancy. Endometriosis. This condition causes cells similar to the lining of the uterus to grow outside the uterus and can lead to endometriomas. Pelvic infections. Severe infections can spread to the ovaries and fallopian tubes, increasing the likelihood of cyst formation. History of ovarian cysts. If a woman has had cysts before, she may be more prone to developing them in the future. 5. Diagnosis of ovarian cysts. If symptoms of an ovarian cyst are suspected, a healthcare provider may recommend several diagnostic steps. Pelvic examination. Initial physical examination to check for swelling or tenderness. Ultrasound. A transvaginal ultrasound is the primary imaging test used to detect cysts. It helps determine the size, location, and type of cyst. Hormonal blood tests. Checking hormone levels, including estrogen and progesterone, to assess hormonal imbalances. Pregnancy test. To rule out pregnancy as some symptoms may overlap. CA-125 blood test. This test may be used in some cases to check for elevated CA-125 protein levels, especially if there's concern about ovarian cancer, more common in older women. 6. Treatment options. Treatment depends on the cyst's type, size, and whether it causes symptoms. Options include watchful waiting. Many cysts resolve on their own and require only monitoring. Medications. Hormonal birth control can prevent the formation of new cysts. Surgical removal. If a cyst is large, symptomatic, or potentially cancerous, it may require surgical removal through laparoscopy or laparotomy. 7. When to seek medical attention. It's crucial to seek medical advice if symptoms worsen or if severe symptoms occur suddenly. Immediate medical attention is recommended for sudden, severe abdominal or pelvic pain, pain accompanied by fever or vomiting, dizziness or weakness, symptoms of shock, e.g. rapid breathing, fainting. Conclusion. Ovarian cysts are common and often harmless, but they can sometimes lead to discomfort or more severe complications. Being aware of the signs and symptoms is important for early diagnosis and management. If you experience persistent or severe symptoms, consult a healthcare provider for evaluation and appropriate care.